death of a child. It fails every time that we imprison an addict for possession, and it fails every time we introduce legislation to further criminalise the addict. The addict has become collateral damage in this state's plight to dismantle the drug trade. Legislation that criminalises possession reinforces the stigma associated with addiction. We can't continue to try and separate the addict from the dealer. I have had dozens of conversations in the last few weeks with people who both sell these substances and use them. Here are two of those contributions. I raised them in order to communicate the reality of these amendments and the people that they affect. A 34-year-old woman from Tala. Even after I was raped, imprisoned, battered, pimped and hospitalised, I have been refused treatments for benzo addiction. Apparently I am not ready, or so some stranger likes to decide. I sell benzos, not a huge amount, just enough to fund my own use and to do some food shopping. I often have boxes of benzos in my possession. A young male, 17-year-old from Crumlin. My brother and I started taking tablets after weekend sessions. We used to rob my mum's Zimmos when we were children, and I deliver benzos for my cousin, so I can get some for myself. I would like to join the army someday, but I can't seem to stop messing around ever since my brother died and my cousin was murdered. Both of these use Zopiclone amongst other tablets. That young boy will never make it to the army if he is prosecuted for the possession, and in the case of the woman from Tala, she risks being imprisoned again if treatment for benzo addiction doesn't become the priority instead of treating her like a criminal. In Portugal, these two cases, if caught in possession, they would have a greater chance of access to much-needed services. The Commission for the Dissuasion of Drug Addiction convenes when an individual is found with drugs. The Commission is made up of a social worker, a solicitor and a doctor or psychiatrist, the outcome being a fine or treatment. Nearly 16 years on, Portugal is not seeing an increase in addiction. In fact, statistics from Transform Drug Policy Foundation shows a decline in the population reporting to have used drugs. Statistics also show that drug use declined in the most at-risk group, 15 to 24-year-olds. We can't continue to ignore the positive progression of Portugal's decriminalisation policies. The British Journal of Criminality in 2010 found that Portugal also shows a decrease in imprisonment for drug-related charges, and there has also been a surge in visits to addiction centres. We will never control the flow of drugs by banning them. Instead, we should be creating policy that increases access to drug treatment and addresses inequality and poverty. Leaving the most vulnerable at risk of arrest reinforces the cycle of criminality. Addiction begins and ends with pain. I ask before you vote here today to consider the fact that criminalising drug possession, which will affect the addict, is us adding to that cycle of pain. We live in a culture, emotionally, psychologically and economically, that punishes those already suffering. The moment we flip these policies on their head and move away from criminalisation, the closer we move to opening up the pathways to recovery and support for our friends, our communities and our values. So I hope you take this into consideration when considering the amendments today. Thank you.
Thanks.